Hi, my name is Dr. Shalini Kamodia, and I'm a dentist at Gentle Dental Care in Vestal, New York. Today I wanted to talk to you about what you can do after you have a tooth removed to help promote faster healing and get that area back to normal as quickly as possible. The first thing you want to do is, as soon as you leave the dental office, you want to make sure you're still biting on the gauze that they gave you. Applying pressure to that area for 30 to 45 minutes after you leave is really important because it's really that pressure that stops the bleeding. If you notice the area is still bleeding when you take that gauze out, go ahead and take another piece of gauze, put it in that site, and bite down with some pressure again. If you don't have any gauze, that's okay. Find a tea bag. Any kind of tea will do, and bite on that tea bag. The tannins in the tea will actually help constrict the blood vessels, and the pressure you're applying will help stop the bleeding. The next thing we want to address is the swelling. It's normal to have some swelling after you have a tooth removed, and generally that swelling will increase until about the third day. But everything that we can do in the first 24 hours to minimize that swelling will make you feel better during the healing process. So taking an anti-inflammatory medication, that could be ibuprofen, that could be Aleve, whatever you're able to take that you take for normal aches and pains, that's an anti-inflammatory, is going to be the best thing to help minimize the swelling. The other thing you can do is stick to cold foods on the first day. Nothing really hot in your mouth, no hot soup or hot coffee. Anything cold is going to minimize the swelling. So that could also mean putting ice on your face. If you had a tooth extracted over here, go ahead and take an ice pack. 20 minutes on, 20 minutes off will help minimize that swelling. You don't want to disturb the area as it's healing. So you don't want to suck on any straws. You don't want to be smoking. That's going to disrupt the blood clot and the healing process. And you don't want to really eat anything sharp or crunchy that could get stuck in that hole during the healing process. It usually takes about 2 weeks for the gums to heal over completely. And so during that time, you want to make sure you're keeping that area very clean. That means after the first day, brushing gently in the area to make sure you're getting food out of that socket. And every time you eat after the first day, you want to gently rinse with some salt water. That's going to help get all those particles of food that get stuck in that area out after you eat, and that will help promote faster healing. So if you have any questions about what to do after you've just had a tooth removed, the best thing to do is really call your dentist and ask them if you don't remember what they said. And if you have any questions for us, please give us a call.